get started. Good morning, good afternoon, or good evening, depending on wherever you are. Thank you to each one of you for being here with us today. Today marks our second anniversary of Global Grace Health, and we are proud to be able to host it today online via Zoom with all of you. Before we get started, I would like to express my sincere appreciation to all of you who generously helped us make this event come together. Now I take this opportunity to invite the visionary, mentor to many leaders, guide, and our very own chairman of Global Grace Health, Dr. Joseph Paturi Garu, to welcome the audience. Dr. Joseph Garu.
Thank you, Andy Suresh. We are so glad that you could all join the celebration, the second anniversary celebration of Global Grace Health. Good morning, good afternoon, good evening, maybe very early good morning for those of our friends from the Far East in Australia and New Zealand joining from there. Much has been accomplished in these couple of years, and we look forward to a great year 2023 and even greater years ahead of us, and the best is yet to come for the work of Global Grace Health all around the world. With this, we'll start off by having the national anthem of United States of America.
Dr. Joseph Garu.
Thank you.
Yeah, without wasting much time, let's go into the agenda. GH Impact by our Executive Director, our Executive Director, Mr. Varma Jampana.
Thank you, Suresh. Thanks everyone for joining us. We'll quickly run through impact in the last couple of years. Our vision has been providing new approaches and initiatives to move forward the healthcare industry around the globe, and mission to advance health, hygiene, and wellness globally through either education, scientific research, modern technology, or innovative methodologies. So we have started, a team of us started in 2020 and registered the nonprofit organization US in January 2021. So it has birthed out of the passion to serve the people back in India through Global Grace Cancer Foundation, and in order to support GCF and extend the things that GCF is achieving to across the world, we have started a nonprofit Global Grace Health in January 2021. We received the tax exemption status from IRS with a few objectives around the preventive health, predicting lifestyle diseases, and working towards making clinical management more efficient, and educating clinicians on the advances in the healthcare, and promoting some new medical devices, and working in the research and development areas, and several other objectives. And the team, including the members and the board, Ms. Chandu Tota being our founding member as well, and Dr. Joseph Paturi Garu took on the president as a chairman to the board, and Dr. Chinnababu Sunkwali is extension of Grace Cancer Foundation. He is member at large with us. And Dr. Kiran Avancha is also in the GCF board, is a vice president and joint treasurer on our board. I am serving as executive director and secretary. And Ms. Suresh Bondugula is the director of institutional advancements in USA. And we have several regions that we have divided into, and for each region we have regional directors helping us, and many other friends and people that are working with volunteers that are helping us. Not to name just a few, but Mr. Shri Amir Shetty from Pennsylvania, Mr. Vidya Garapati from New Jersey, Ms. Murli Pasmati from Massachusetts, Ms. John Sunkwali from New York. And from the North Central region, we have Dr. Joseph Pottergari himself from Ohio, and Mr. Adam Kolipar from Michigan. And on the South Atlantic side, we have Mr. Dash Chebatini from Washington, D.C. in BMU area, John Spurgeon, Tennessee, and Mr. Deva Veraswamy from Texas, Mr. Emmanuel Rampa from North Carolina. And from the West, we have Dr. Kiran Avancha from Arizona, Sunil Magadati from Colorado, and also Mr. Clement Lavu, and Mr. Babu Peter from Utah, and Ms. Chandu Tota take care of our operations in California. And internationally, from Africa, Dr. Ajiboye has a team of people that he's working with across Africa and several other countries. And thank you, Dr. Ajiboye, for your passion. And from Far Eastern Australia, we have Mr. Enoch Moses and Dr. Ravi Musku. And from Europe, we have representation from Ms. Sonia Chadanihal and Mr. Peter Samuel. And from Central and South America, we have Ms. Paulina Risco, that's helping us with several Grace Cancer Run and awareness camps as well. Internationally, through Grace Cancer Foundation partnerships, we have the board of the Grace Cancer Foundation, Mr. B.L. Sujatarao, Dr. Pramila Rani, Dr. Kiran Avancha, Dr. Chinababu Sunkwali, and Dr. Hemant Udayaraju. And our impact in 2021 through GCF has been working with them along with our other partners as well. We were able to deliver about 1 million plus surgical masks during the second wave of COVID-19 in India. And we were able to distribute our own plus our partners around 325 ventilators and medical grade oxygen concentrators around 265, 2 dialysis machines in rural hospitals in Anmakonda, and vaccinations around 5,000 plus. And in our impact in 2020 through GCF is we have reached around 10,000 lives through cancer screening camps. 500 plus volunteers participated in the run and several other activities across the world from 130 countries, and around 100 events were conducted. And even though GCF, Global Grace Cancer Foundation, has reached out many more lives, we are looking at the ones that are reached through Global Grace Health here. And our education through online webinars and in-person meetings during the cancer awareness run and several other events, and through Global Grace Cancer Run and Grace Cancer Run 2022. There are several countries across the world that participated. Around Australia, 4 countries, Asia 36, and Europe 25, Africa 42 countries, South America 13, and North America at least, around 10 countries, North and Central America, 10 countries have participated. From the Global Grace Cancer Run in 2022, this is the first year we had a lot of success in having different states picking up, and from Washington, D.C. to Boston, Houston, Colorado, Raleigh, North Carolina, New Jersey, and Detroit, Michigan. Several people have participated from each of these places in the awareness run. And internationally, from Australia, Colombia, Africa, Europe, and different parts of Africa as well participated in Grace Cancer Run. Our key focus areas have been modern technology and innovative methodologies, achievement through treatment by using innovative methodology. Case in point, an application was developed by Grace Cancer Foundation and volunteers from Global Grace Health team as well, NeoPact Health app. It's used for capturing all the electronic health records of patients screened at various cancer screening camps conducted by Grace Cancer Foundation. Around 4,000 plus records are available in the database now and growing. We have 5 state-of-the-art cancer screening buses through GCF and that are supporting 10,000 screenings in Telangana and Andhra Pradesh that is supported by Global Grace Health. That's our focus for event 2023 as well. We have done this, we are able to accomplish this all with the great support from our partners like PTA, Philadelphia Telangana Association, QData, Lucidus Solutions, Pi Health, Movers.com, EmergeTech, Smart IMS, and several other partners, Michigan Academy of Taekwondo, Telangana Radio, Team Intensity, and Northville High School. And many more friends and families and well-wishers across the USA and across the world as well. The road ahead, we wanted to do screening of 10,000 people even in this year as well, and wanted to create awareness drive in 130 countries, education to reach 1 million. And we wanted to be a lifestyle coach through Grace Cancer Run participation in 15 plus locations that we are aiming in 2023. And we wanted to look at some of these application for detection of cancer, some data for research and paperless screening and digital screening, and encouraging cancer vaccine like HPV vaccine for cervical cancer free campaign. And the Project 10K screenings, as I said, 100 plus camps we wanted to have. The cost is like around per screening, it comes out to $10 to $15. So the aim is to do it in rural Telangana and Andhra Pradesh and extend it beyond in the coming years. How can we partner? Partnership for research through technology, education, and screening. Help us raise funds, get someone screened. If you have a village that you have some roots from, get your village screened in these places. And you have an offshore company, you can also work with your HR to get your company employees get screened as well. And we would quickly go through a curtain riser video.
Global Grace Health was born in the year 2020 to envision new approaches and initiatives to move forward the healthcare industry around the globe. The core mission of GGH is to bring awareness about preventive health, to predict lifestyle diseases, and to serve as a personalized and customized lifestyle coach, to promote new medical devices and digital health, to stimulate research and development in the field of healthcare.
We achieve our mission through education, scientific research, modern technology, and innovative methodologies. So a newer, innovative approach is the mantra of Global Grace Health.
Within 2 years of existence, Global Grace Health has touched thousands of lives through collaboration and partnerships with Grace Cancer Foundation, PTA, Tana, Smart IMS, Pi Health, EmergeTech, and many organizations like these. Last year, Global Grace Health partnered with Grace Cancer Foundation and supported Project Cancer Screening, touching over 10,000 lives. The mobile cancer screening buses reached the most unreached areas of both the states of Telangana and Andhra Pradesh. Wherever there were roads, the buses could travel. The buses would go to bring healthcare to the doorsteps of people. This warlike effort against non-communicable diseases saved many thousands of lives. Global Grace Health was instrumental in raising cancer awareness through Global Grace Cancer Run 2022 with participants from 130 countries spearheading support for cancer prevention. In the US alone, the Cancer Run was held across several locations including Boston, New Jersey, Washington DC, Raleigh, Houston, Colorado, and Detroit. Global Grace Health has provided a digital push to Grace Cancer Foundation. Through its efforts, the entire cancer screening process has been digitized. Grace is now powered by technology. In the year 2023, 100 mobile cancer screening camps are planned to touch another 10,000 lives. Touching lives and making meaningful difference is in the ethos of Global Grace Health.
We're humbled to receive the support from Global Grace Health volunteers and donors across the world and thank each and every one of them. Thank you and God bless.
Please join hands with Global Grace Health and together let us reach the unreached.
Right. Thank you. Thank you, Varma, for this wonderful presentation on Global Grace Health, how we are impacting through the coordination, support, contribution, and donation of our partners and touching many lives in the past year. And also in 2023, we will be doing much more to touch the lives of many and helping extending their lifespan and providing great health. Thank you very much, Varma. Now I request Dr. Joseph Paturi Garu to introduce our chief guest.
Now it is my honor and privilege to introduce our chief guest, Dr. Varun Jeph, Deputy Consul General of India, New York. Dr. Varun is a medical doctor himself, serving in Indian Foreign Service as a diplomat. He has over a decade of experience in Indian Foreign Service. He served in different countries, including in the Indian Embassy in Myanmar and Indian High Commission in Malaysia. And in between his overseas assignments, he also served at Ministry of External Affairs and involved in the administration and human resource management at External Affairs. Now may I request Dr. Varun Jeph to bring his inauguration and greetings message. Thank you, Dr. Varun.
Thank you, Dr. Paturi Garu. Namaskar to everyone. Dr. Joseph Paturi Garu, President of Global Grace Health, Padma Shri Dr. Dattatreyudu Nori, renowned radiation oncologist, executive team, members of Global Grace Health, all the volunteers associated with this wonderful organization, ladies and gentlemen. On behalf of the Consulate General of India in New York and on my own behalf, I wish very good morning to all of you and a very warm namaskar, namaste to you all. Friends, it is a privilege and a pleasure for me to join you all this morning, and you all illustrious physicians, humanitarians, philanthropists, and most importantly, compassionate human beings. I mean, you have been dedicating your time, your energy, your expertise to this noble cause of promoting health and wellness, particularly to those who are most in need of it. As Dr. Paturi Garu mentioned, I myself come from a medical background, and having joined the Foreign Service, I'm now in a profession and with responsibilities where people are at the focus of our activities, and efficient and effective public service delivery is a priority for us. And I'm particularly delighted to join today's event, not only as we celebrate the second year anniversary of GGC, but as we also feature a talk on a very important topic, that of cancer. Friends, we have all grown up hearing the ancient wisdom that prevention is better than cure. And perhaps many of us have ourselves been telling it to people around us. And yet we find millions and millions of people around the world suffering and losing their precious lives, many a time at a very young age, to illnesses that are preventable altogether, or which, if diagnosed at an early stage, could be cured completely with timely intervention. And in that, the role of screening, of early detection, of early treatment and cure, especially of preventable diseases, especially of lifestyle-related illnesses, non-communicable diseases like cancer, like diabetes, like hypertension, etc., it cannot be overemphasized. And talking about health, health is something that finds a central place in Sustainable Development Goals, particularly the Sustainable Development Goal number 3, which aims at collective efforts towards promoting healthy lives and promoting well-being for all at all ages. Friends, you may also be aware that this year, India has taken over as the presidency of G20, a strong grouping of nations which accounts for not only 85% of global GDP, but perhaps more importantly, 2/3 of world's population. When you're talking of 65% of the human capital of the world, of this planet, this grouping becomes very important. And here, global health with equitable and accessible healthcare for all is a priority for India as it takes on the presidency. We strive to build resilient health systems and frameworks which can reduce disparities in healthcare availability across the world. And because we are talking about health, because we are in New York, we have friends joining from all parts of the world, particularly from India. I would also like to share that India and United States are two countries, beside as a part of the larger strategic partnership that we have, there is also a long-standing collaboration in the field of health, including in areas like HIV and AIDS, strengthening sustainable healthcare systems, infectious diseases, and of course, lifestyle-related diseases, non-communicable diseases. Our experts, we have been working together on developing reliable and developing affordable vaccines. RotaVac vaccine is one very classic example where it used to cost, one vial used to cost $60. And after collaboration between two countries, after we started manufacturing it in India, each vial, the cost came down from $60 to just $1. So that is what we can do together. We are also working together on strengthening our supply chains of essential items, on exchanges of best practices. That is where you all medical experts and other experts come into picture. And we have been expanding cooperation on development of therapeutics and vaccines and finding low-cost innovation solutions to problems that face us. Dr. Verma mentioned about COVID, and this pandemic, it brought to fore our vulnerabilities. It proved once again that health remains our real wealth. And in an increasingly interconnected world, we need to forge our capabilities and capacities to overcome any healthcare challenge that we might face. Just as you all united in this once-in-a-century adversity that the pandemic was. You turned adversity into opportunity, bringing some of the best medical brains and some of the most compassionate and kind hearts together. And in just 2 years of existence, I'm very happy to note that Global Grace Health has done some outstanding work. And we compliment and we exalt the remarkable contribution of Global Grace Health in extending support, in reaching out to your sisters and brothers back in India during the pandemic, and particularly so during the ravaging second wave that we saw in the early part of 2021. So I congratulate all the members, the executive team, volunteers, patrons, and everybody who's associated with Global Grace Health for their extraordinary role in spreading awareness about healthful living, and more importantly, about teaching about how to lead such a life that is healthy, which is healthful both for the mind and for the body. This organization truly personifies the Indian philosophy of Vasudhaiva Kutumbakam, that the world is a family. You have reached out to millions of people across 6 continents, across the world, with health screenings, with cancer runs, as was shown. 10,000 people being reached out in cancer run. I mean, that's a phenomenal feat. You have also been engaged in vaccination drives and leveraging technology to build better and a healthier planet. Friends, before I conclude, I would like to also mention and share with you all that at India's initiative, the United Nations has declared this year, the year 2023, as the International Year of Millets. It's been celebrated across the world. These nutritious grains, millets, which used to be part of our diet, they have gone missing from our plates in the last few decades. Millets are gluten-free. They are rich sources of minerals, rich in proteins. Therefore, they are health-wise, but they also consume much less water compared to other grains like rice or wheat. So they are also environment-friendly. They are also water-wise. So through this platform, through your organization, I urge you also to create awareness about millets and join this global movement in promoting good health and in saving the environment. Once again, on behalf of the Consulate General of India, I convey our warmest greetings and our best wishes to Global Grace Health and to everyone who's associated with it. May you all continue to work with the same resolve, the same vigor, and touch lives of millions and millions more around the world. I look forward to hearing from all the other distinguished guests, and particularly from Padma Shri, Dr. Nori, and learn from the exposition that is to follow. I thank you once again for giving me this opportunity, and it's been a pleasure joining you all. I wish you all a great year ahead. Thank you so much. Namaskar.
Thank you, Dr. Varun, Jeph. It is truly an inspiring speech, and it is really encouraging to all of us as fellow Indians and people who are in different countries, especially in America. We'll continue to coordinate with the Consulate General of New York and also carry out the vision and the inspiration to reach out to many in India. As you said, it's Vasudhaiva Kutumbam. Definitely, we will be helping as co-brothers and sisters to reach out many people. And we are glad to know that 2023 is being announced as a year of millet. And we'll definitely, try to coordinate and propagate this message of year of millet and providing good health as well as good food to our fellow people, whether it is in India or in other parts of country. Thank you very much, Dr. Varun, once again. Now I request our regional directors to share the reflections. To start with, Mr. Vidya Garapati from New Jersey.
Good evening, everyone. My name is Vidya Garapati. I'm the Regional Director of Global Grace Health. Also, I am part of a few other nonprofit. First of all, greetings to all the dignitaries and Deputy Consul General Dr. Varun, and also Padma Shri, Dr. Nori, and founders of Global Grace Health, Dr. Joseph Paturi Garu and Dr. Chinna and others. They say for anything to start with, it has to start with one single brick. And to start any journey, it has to start with one step. So that took a part from this journey last 2 years back. And now we are celebrating 2 years anniversary of Global Grace Health. Even though the backbone of this organization is Grace Cancer Foundation back in India, but achieving so many volunteers, I can see here 150 people attending this meeting. That speaks the volumes of this organization and volunteers and the like-minded people that are coming together to work for the greater cause of cancer prevention and other awareness of health in general. last year, I am really proud to say that we have, with the help of local volunteers and other sponsors, we did take a part of Grace Cancer Run, representing New Jersey. There were about more than 200 people participated in that run. And also in December alone, through our efforts, not directly from Grace Global, Global Grace Health, but working with the Grace Cancer Foundation, we did about 25 cancer screening camps and reaching out to 10,000 people in December alone. And last 1 year, through our efforts, we did more than 50 cancer screening camps through Grace Cancer Foundation. So I'm really delighted to be part of this wonderful organization, and thanks for this time.
Thank you, Mr. Vidya. Now I request Shri Sethi from Philadelphia to give reflections.
Thank you, Suresh. Good morning, good afternoon, good evening, all. Thank you for giving me this opportunity. My name is Shri Srinivas Sethi. I'm the director for Northeast region in the United States. So, as everybody's talking about, what GCH is doing, right? And congratulations to the team and reaching to the 2nd anniversary, and kudos to the team to reach this milestone. So, and I'm also very much interested to do my contribution and to take this to the next level and reach the health to the unreachable people across the world. I'm also part of a Philadelphia Telangana Association, and trying to get funds from various organizations to GCH to do the things what we are doing. And Suresh and I also part of the Philadelphia Telangana Association, and which is a non-profit organization in Philadelphia area. And we talked to Philadelphia Telangana Association about GCH, and hey, we need some funds from that. And the team of Philadelphia Telangana Association, they agreed that okay, so we are kind of a like-minded groups, like-minded people, and serving the people. And they agreed to give some donations what they are collecting to do from back to in India, and they are agreed to give these kind of funds to GCH to serve the people what we are trying to do. Again, thank you very much for everybody, and I'm very much honored to part of this team, and would like to continue to serve my time to the team. Thank you.
Thank you, Shri Sethi. Indeed, PTA, Philadelphia Telangana Association, along with your collaboration, is really a great part of the success of GGH and many screening camps in GCS. GCF also in India, as said by similarly by Vidya Garapati. He is also coordinating and supporting through Thana. Now I request Mr. Das Chevatni to share his reflections.
Good morning and good evening. My name is Das Chevatna. I'm the regional director from Washington, D.C. area. First of all, thank you so much for this opportunity that was given to me. I've been with GGH for the last 1.5 years. Congratulations to GGH as we celebrate its 2nd anniversary. Every one of us have different opportunities around us to respond to our social responsibilities. I feel being able to help to the people among us in the field of healthcare is noble, very satisfying, and especially there's a huge need. So GGH is a platform with a great mission if you're really wanting to be part of it. Being the regional director from Washington, D.C. area, we had a wonderful year 2022. We had successfully organized a Global Grace Cancer Run, a 5K run, with a tremendous support and participation from the volunteers and the community. We had around 160 plus participants in the run. Even though it's a very first time that we have organized an event like this, we're able to reach out to many people and bring awareness about Global Grace Health. And we were able to promote the work that GGH working with the GCF are doing here in US and even globally also. Especially not as an organization individually, we were also able to collaborate with other organizations locally to be part of this run and make a big success. And in 2022 itself, we are able to establish partnership with a couple of organizations in this area to support us in fundraising, and that we were able to use that funds to run some camps in India. Myself, I am fortunate that I'm able to see and be part of the work being done on the ground in India. In the month of June, when I was traveling to India, we have organized a camp in Eluru in association with Grace Cancer Foundation. And even as of last week, we have organized another camp in my native place, Gundugal near Eluru. We had a great response from local people and elders and leaders, and the event was very successful. It is a great experience for me to be part of it and organizing camps like this. It helped me to understand the challenges on the ground, because from here we may not be able to see what is going on there, and the hard work that we put there, and even expectations from people, what as an organization that we do, and how hard it is to execute a camp like this. Above all, we're able to see the impact that as an organization, GGH and GCF, how we're able to make the impact in the lives of the many people around. And I have witnessed the dedication and the commitment from staff and the leadership. For this year, 2023, we are committed to continue our efforts to bring more awareness and organize some more events like this. Our focus would be for this year, reaching out to many people, but from different communities and groups. That is our focus, and especially building more partnership to work together. I'm sincerely thankful to all our supporters and partners. Let's continue to work together in this mission. Thank you so much.
Thank you, Mr. Das. Thank you. And really, it is really appreciable for your contribution and support, especially in the Washington, D.C. area, whether it is Grace Cancer Run or contributing and supporting in India, especially in East and West Godavari districts through Grace Cancer Foundation for cancer camps. Dear ones, the regional directors, please bear in mind, we have only 1 minute to share. So try to adjust your, sharing of reflection within 1 minute. Now I request Mr. Deva Veeraswamy to share his reflections.
Greetings to all the dignitaries for the Grace Cancer Foundation, and congratulations again on the 2nd year anniversary. I've been with the Grace Cancer Foundation for the past 1.5 years now. In 2002, we were able to coordinate a cancer run in regional parks and churches. Mainly, I was able to connect with the local churches and also with the Indian Association of North Texas in Dallas. That is the region that I'm supporting currently. And we were able to also connect with several corporate organizations from all the major corporations that we have in Dallas area. So that was one big achievement, that we were able to sow the seed of this awareness that is happening. And they were very appreciative of this initiative and very thankful that this was an avenue that a lot of Indians and Asians who were able to come to North America were able to share all these details. And so they were very willing to support this movement as well. And then we were able to also connect with a few non-profit and religious organizations we were able to share that info as well. This year, we have a big plan that we wanted to connect and bring all these groups together and have a much bigger run than last year, and to bring much more awareness, as well as several camps that we will be able to organize this year. So we are looking forward to that, and we are so thankful for all the leaders from Dr. Chinnababu as well as Dr. Joseph Paturi for their leadership and their guidance and direction in terms of leading this effort, as well as giving us an opportunity to serve in a cause that is good for the humanity and the love and kindness that we were able to share for our fellow citizens back in India and throughout the world. So thank you very much for this opportunity. Greetings from the regional Dallas, Texas area. Thank you so much.
Thank you, Dave. It's wonderful to know how you organized the Grace Cancer Run, and hope to have many more people to participate in 2023 year. Now I request Sunil Mogadati to share his thoughts.
Hello, everyone. This is Sunil Mogadati from Denver, Colorado. I'm one of the regional directors here for the West US region. So a quick update on what we have been doing in this region. So for fundraising, we used the mode of conducting tech trainings that cater to job seekers in the IT field. So we use that mode to raise some funds, which help to conduct screening camps in about 7 villages in India, touching about 700 to 1,000 lives in India. We also did the Global Cancer Run at the Denver locations, which is one of the locations for the cancer run. So the run included a lifestyle awareness talk from Dr. Sunil Kumar from the Denver Health Hospital. We also obtained corporate sponsorship, and about 50 runners participated in the run, and a lot more watched the lifestyle awareness video on YouTube. This year also, of course, we believe that as humans, our primary responsibility and purpose is to serve and empower one another and help collectively solve problems. So based on that belief, this year also in 2003, we want to continue the same thing and even more. We want to conduct tech trainings to fund for more locations, screening camps and health camps in Indian villages. We also want to conduct the run in Denver, and we want to add more regions in this, more locations in this region. We also want to do online webinars and lifestyle awareness activities on health and on cancer and other health awareness issues. So thank you, everyone.
Thank you, Mr. Sunil. It's great to hear from you how we are organizing cancer runs and also planning for 2023 years to have more runs and also to have some webinars. Thank you again. Now I request Mr. Subbu Manikonda to share his thoughts.
Good morning, greetings to all the adults in this team. I'm from Houston, Texas. I'm glad to be part of this great team. And I'm glad to be part of I know the impact the global Grace Cancer is creating the entire world and creating awareness in the cancer. So we started, like I'm being part of this Grace Health from last 3 years. And in the third year, we are always, so we are like tripling every year the participation. Last year, we had around 300 plus participants in the Grace Cancer Run. So that is one of the pillar of, creating a healthy awareness. So that is one of the pillar of avoiding the cancer. So when the people pinged me and saying I continue my run, so I think last week also after Houston Marathon, some people pinged me saying, hey, after your run helped me to get motivated. I'm doing healthy and I did my half marathon, full marathon. So that's giving more happiness being part of this team. So looking forward to more members, more participants in our run and creating more awareness on the Grace and the cancer. Thank you, everyone.
Thank you, Mr. Subbu. You are a great inspiration for our Grace Cancer Run and motivating all of us to run more for a good cause and making a awareness of this requirement for cancer screening. Thank you very much one more time. Now I request Mr. Adam Stephen to share his thoughts.
Hi, everyone. I'm Adam Kolapara. I'm a North Central Regional Director. I'm located in Michigan, USA. I joined GGH a little over a year ago by invitation of my uncle, Dr. Paturi. Last year, I spoke in the first anniversary meeting about one of the objectives of GGH, but this year I'll give more of a review of what I've actually participated in this past year. So in fall 2022, I hosted the first Detroit Metropolitan Global Grace Cancer Run in Northville, Michigan, which was locally sponsored by Michigan Academy of Taekwondo, where my brother is an instructor, as well as the Northville High School Band, where I'm the percussion instructor and marching band assistant. So the 2022 run was sort of a pilot run to gauge the interest and promotion of the run, at least in this area, as the promotion through me was primarily through the Taekwondo school and the band. And most of the participants were that run were from both of those schools. The weather was cold and windy since we had to host the run in late October due to scheduling conflicts with our just planning as well as the location that we were using. So we had less than 10 running in person, but we had a handful of others who participated virtually and also gave monetary donations, which was great. For this year, I'll be hosting the second annual Detroit Run, and we're hoping for many, many more participants in addition to those who ran this past year. Also, more recently, in just the past couple of weeks, I helped with the CFC charity application writing and review process. And then in addition to that, I'm just looking forward to being more involved in the coming years with the team. Thank you.
Thank you, Adam. Now I request Mr. Murali to share his thoughts briefly within less than 1 minute. Thank you.
Yeah, namaste everyone. My name is Murali Pasmarthi. I live in Boston, Massachusetts, and it's a great privilege to be part of Global Grace Cancer Foundation. And also, I'm very fortunate to be part of Grace Cancer Foundation from its inception. I'm trying to help whenever and wherever possible, to spread the word, to create awareness. And part of 2022 Cancer Run in the Boston area, we did baby steps as a small group, and I've got wonderful support from Dr. John Alurugaru. And then based on the learnings from 2022, we are planning to start little early, spread out, and communicate to and reach to most of the communities all around the area, and try to create awareness and create much more impact through their support. That's the plans for this year. Yeah, thank you.
Thank you, Mr. Murali. Let's take the next person, Mr. Arvind Katragada from North Carolina.
Thank you very much. Thanks, everyone. Thank you, first of all, Varma Garu, for introducing Grace Health Foundation. So it's last year I came to know, and also when I went to India last year, I met with Dr. Chinababu Garu, and it's a great effort that you guys are doing, and it's I'm really humbled to see the way what is getting done. And also the way Varma Garu came here, and this year, last year, as a part of the Cancer Run awareness program, he conducted. There about 40 people attended this within a short period of time, and also the local congressman Julie Heffen also joined, and also she participated, and she was really encouraged about this. And also, Varma Garu is also working with many folks in this area to expand this into the 2023 awareness program here. And personally, I felt this is a great effort and not an easy work to do. And you guys are doing a great job. I thank you all, whatever you are doing. And this is good for many people. And I ask God to and pray for this group to be blessed and do more and more for the glory of His name.
Thank you, Arvind. Thank you very much. Keeping cognizant of time, let's move on to the next item. Now I invite our very own Dr. Chinababu Sunkavalli, who is the person behind all this, what's happening, reaching many lives, touching many lives, inspiring all of us, a true visionary, leader, and inspiration to many, and running towards touching many lives, changing many lives, life pattern, life style, and their health. Dr. Chinababu Sunkavalli, I would request you to introduce our keynote address speaker, Dr. Nori.
Thank you, Satish. Well, it's my privilege and honor to introduce our keynote speaker for today, Dr. Dattatreyudu Nori. He is not only a professor and director of the cancer centers at Presbyterian Hospital and Queen's Weill Cornell Medical College as well, but more importantly, he is very connected to us because he is our advisory board member at Grace Cancer Foundation, and he is a very well-known, renowned name globally in the field of oncology, more so in the field of radiation oncology. He is a recipient of Padma Shri Award, and he has done marvelous work in the field of brachytherapy. He comes from Machilipatnam district, Andhra Pradesh, did his medicine from Cornell Medical College and post-graduation from Osmania Medical College. And more than anything else, his zeal to give back to the community back in India, that is something that really connected us. And we're really honored to have Dr. Nori as our keynote speaker for today. Welcome, Dr. Nori. Thank you so much for all that you do for Global Grace Health and Grace Cancer Foundation. Welcome.
Thank you. Thank you. Can everyone hear me?
Yes, sir. We can hear
Yes.
you.
Okay. Good morning. Good evening, wherever you are. Thank you, Dr. Chandrababu, and all the advisory board members of Global Grace Health internationally and Grace Cancer Foundation in Hyderabad, India. I'm very delighted. I'm very happy to participate in this Global Grace Health second anniversary meeting. And let's start with the next slide. Okay. This one, follow the extreme on the left side. Global cancer cases estimates 2015, 15 million, 2035, which is not too far, is 24 million. And where are these cases going to be? In developing countries. So unless the only way these projections can be modified or reversed is through organizations like you. I wrote an editorial in Times of India last month, how to address the cancer burden nationally and globally. All the advances which I'm going to show in the next few minutes about advances in molecular technology, innovative technology, clinical trials, clinical innovations, all that is part of the story that will address patients who already have cancer. But the only way we can bend the curve, we can reduce the cancer burden globally and nationally is through what you guys are doing. I really admire your association, both the Global Cancer Health and also Grace Cancer Foundation India, introducing the concept of cancer awareness, screening, and early detection. These are the three mantras if you want to change these projections of from 2015, 15 million new cases globally to 24 million new cases in globally in 2035. And to bring the point home, in India, 200 women are dying of cervical cancer every day. 1,600 of our citizens in India are dying per every day. These are alarming numbers. Why they make us feel bad as oncologists, as something that we are all doing, trying to do in oncology, is 2/3 of the cancers in India are preventable. The next statement is they are preventable but not prevented yet. Very important statement. The organizations like yours will make it happen. I'm very proud to be associated with your organization. Next slide, please. Now I'll show you the other part of the story. Clinical advances. Is cancer a death sentence? No. There's so many advances have happened in the last 25, 30, 40 years, which I have witnessed, and I have contributed to some of the advances from Sloan Kettering and New York Presbyterian, Cornell University. I will make it, even though some of the slides may look complicated, I'll try to make one point to make sure everyone understands what is there. Evolving paradigms, new discoveries in cancer, advances in clinical oncology. Next one. Evolving paradigms. This is not a rocket science. What we used to do when many decades ago is look at the size of the tumor, the histology, the pathology, the grade of the tumor. That's no longer the case. We now have markers. We look into markers, ploidy and receptors. Now the tertiary predictors are we look at the gene expression, EGFR expression, molecular and proteomic profiling. What in simple terms, our understanding and the molecular underpinnings of cancer we understand much better now than before. This is very important. This slide may appear very complicated. I'll make it very simple. Take, for example, a wheel, a bicycle wheel. It has spokes and a center hub. The center hub is the nucleus, where you see the central bluish structure is the nucleus, the DNA. And the DNA gets multiplied. In the past, we didn't know what signals this DNA to multiply and become a tumor and metastatic cancer. And about 25 years ago, we came to know that the signals for the DNA to multiply is not coming from the center, from the periphery of the wheel, that is the periphery of the membrane, all the signals. One signal coming from the periphery of the membrane telling the cancer cell, multiply, multiply. The other signal is telling the cancer cell, get your own blood supply. The other signal is giving a signal to the cancer cell, develop your metastasis to the lung, brain, bone. So these are all the signals. Then what we did through our technological advances in molecular sciences, we developed these targeted drugs or designer drugs to block each signal. If I block one signal, that kind of activity from the cancer cell disappears. For example, metastatic potential, or developing its own blood supply, or lung metastasis, brain metastasis, all those. So we found all these in capital, in their bold letters: transmembrane, Herceptin, cetuximab, rituximab on either side of the slide. These are all targeted drugs to block those particular signals. Was there any impact in cancer cure rate by targeting these signals? Of course, yes. Next slide. Next slide shows these targeted drugs made significant impact in improving the cure rates of several cancers. For example, Herceptin for breast cancer improved the cure rate by 30%. Avastin, that tells the cancer cells to not to produce its own blood supply or curtail on the blood supply, produced significant improvements in lung cancer, ovary cancer, and colon cancer. Rituximab for lymphomas improved the cure rate by additional 50%. Erbitux head and neck cancer, Tarceva in lung cancer. Tarceva, I'll just give you one example. Tarceva, some of these targeted drugs are not even injections, they are pills. If you take a pill, especially for head and neck Tarceva, stage 4 lung cancer patients can survive 10 years. I have so many patients coming from India to see me in New York with these particular signal modification, and we put them on these drugs, this particular drug Tarceva, they survive 10 years, even if they have metastatic disease, without any problems, they survive, without any symptoms. Gleevec for chronic myelogenous leukemia. This is a pill, tyrosine kinase inhibitor. This pill will cure chronic myelogenous leukemia. Cure. The next one is for multiple myeloma. So the take-home point here is the next development in cancer field is the targeted drugs, which are helping to improve the cure rate. But if you, for any common man or oncologist, the next question is, each drug is working on a single signal. It's blocking one signal. But cancer sometimes is a complex disease. It may be due to multiple signals. So what is that treatment available that can turn off all the signals coming from the cell membrane or the wheel of the bicycle? That is immunotherapy. Immunotherapy will turn off all the signals from everywhere and improves your own immunological stimulation to fight the cancer. It's a paradigm change. It's a incredible innovation in cancer treatment is immunotherapy. It's going to change. Pharmaceutical companies in America and everywhere, they're spending billions of dollars on developing new drugs for immunotherapy in cancer treatment. Go back to the previous one, please. immunotherapy. I will make it very simple to understand. As the cancer cells grow in the body, it produces two antigens or nasty materials to knock down your command and control system in the body, which is your immunological system. So two nasty substances produced by cancer cell as it grows in your body, or one is called CTLA and the other one is PD-1. Forget about the names, but the two nasty substances are produced by the cancer cell to destroy the immunity in your body. Go to the next one. Next one. These are the CTLA and PD-1. Next one. Then next one. Next one. Okay. You can go to the next one. Okay. The combination now, we came to know that when you combine radiation, chemotherapy with immunotherapy, there are several patients surviving many years, 10 years, 15 years, which we never heard with a metastatic disease, people surviving that many years, free of cancer, free of cancer. This is one example. I don't know whether you can appreciate. This is a patient early on in our studies, has a lung cancer with a metastasis to the liver. You can see on the left-hand panel, liver metastasis and base of the lung metastasis and pre-sacral metastasis in the pelvis, in the body. And we treated him with immunotherapy and radiation to the liver, with a few treatments to the liver. And this patient is alive at 14 years now with all the scans being clear, PET scan, and living well. These are some of the most gratifying examples you can see using immunotherapy with other standard care like radiation and chemotherapy. Next one, please. Our US president, you all know, he has cancer with metastasis spread to the brain, bone, lung, and liver. If we don't, in those days, the treatment, whatever we offer, he will have a survival of only 6 to 8 months. We treated him with local radiation and immunotherapy. He is now 12th year, free of disease, going to 13th year, completely all the scans are clean, and he's now 93 or 94 years. Next slide, please. Why am I showing these two individuals? I mentioned before, cancer as it grows in the body produces two nasty substances to knock down our immunological command and control center in the body. And those two, the first one is PD-1, discovered by this Japanese scientist, MD, PhD scientist. The second one is CTLA4, is discovered by our New York scientist, James Allison. Those two people got one Nobel Prize for discovering those two nasty substances. Now we know how to destroy those nasty substances in the body with using what is called immunomodulators. So this is a game changer in cancer treatment. Next slide, please. Genome Atlas, reproduced during the term of President Bill Clinton, gave us so many clues and molecular underpinnings of cancer. Next one. Next one. Yeah, this is, I'll describe to you what kind of information was useful from this cancer atlas, genomic atlas, produced many decades ago. If we have 100 patients with lung cancer, for example, or breast cancer, all of them have stage 1 cancer, same size, same pathology, same age group. We treated them with same mantra, same therapy. 70% of them are cured, 30% of them are not cured. Why is that? It's the same size of cancer, same stage, same biology, same pathology. Go back. Then we came to understand that the molecular underpinnings of that particular cancer in particular individual is not the same as the other next patient. We came to know only through this molecular research. Then next one, the drugs we use what we were using on those 100 patients is the same medicine, same mantra. But in this standard group in the center, this is has a multiple molecular types of cancer, even though same stage of cancer. For on the top green panel, the drug we are using was toxic and beneficial. The other side, magenta, you see drug toxic but not beneficial. On the bottom, drug not toxic, not beneficial. The yellow, the blues are drug not toxic but beneficial. You see here, small group, this is the group you want to use the drug. Drug is not toxic but beneficial. But in the past, we are using the same drug on those 100 patients, and all the other three groups is a totally waste of their money and waste of our time to experiment the drug on them, even though everyone has the same type of cancer. The take-home point here is not all cancers, even if they have the same stage, are identical. Their molecular structure is different. So based on these molecular structure nowadays, what we call in Hyderabad, in India and here is called next generation sequencing, what is called NGS. If you do NGS, it will tell us whether that drug is going to be useful for that individual patient. This molecular profiling studies, next generation sequencing, both for cancer and other diseases, you can predict at what age group a particular individual will get what type of cancer. This, for example, there is a P3, clear cell carcinoma of kidney is due to one loss of P3 chromosome, and mutation of this can produce the earliest event in the tumor evolution of kidney cancer. So if they have that mutation, you can say this gentleman at the age of 50 will develop kidney cancer. So we have that kind of advances in cancer molecular biology. Next one. Advances in clinical oncology. This is, you will understand much better about clinical advances. What I have shown you is the evolution of advances both in targeted therapy, in immunotherapy, and combination of immunotherapy with radiation and chemotherapy. In radiation, there are many advances in technology. The technology has taken over the field of oncology, especially with radiation. Next one. And we are now using stereotactic techniques to precisely treat the cancer wherever it is, in the pelvis, lung, brain, or pancreas, anywhere. What is that important? Why it is important? When the precision improves, you can cut the margins and treat only the lesion. So the toxicity significantly disappears when the precision improves. When the precision improves, you can deliver higher doses of radiation. So you don't need 6 to 7 weeks of treatment for this particular cancer. You can deliver that in 2 to 3 fractions because the treatment is incredibly precise. Next one. And this same patient treated with stereotactic body radiotherapy with high precision treatment. You can see here at 5 years on the other extreme panel, you don't see the cancer at all at 5 years with no significant complications or toxicity in the surrounding lung. Next one. Another game changer in radiation treatment is the proton therapy. Very few centers have proton therapy centers. Even in India, there is only one at the time being. They are getting another one in Hyderabad. In US and Europe, we have many, many centers. I will just go to show you how precise these proton treatments are. Next one. It's a very expensive technology. Eventually, the price will come down that every country will be able to offer this treatment. These treatments are so precise. Next one. Next one. Next, yeah. You can see here on the standard radiotherapy, when you apply the deep beam, the beam goes through and through the body. You can see that purple light going through and through. On the other side, proton therapy, the beam will go and treat the cancer, and there is no radiation behind or around it, unnecessary radiation. So it's so precise, the beam will not travel to other parts of the body. So if that is the case, where is the indication for this? In what cancers? Is pediatric cancers? in central nervous system cancers, this particular proton beam therapy is extremely useful. Hopefully that will be available in many centers in India and globally. Next one. Next one. These are all just animation slides to show how precise. Now we are combining standard linear accelerator with MRI technology, the magnetic resonance technology, where the precision has improved 100-fold. So we are delivering treatments with a few fractions. The patients come to us in Manhattan, if it's a lung cancer, pancreas, or liver, or brain, we do the planning and we treat them with what we call ViewRay, MRI plus LINAC combination in less than 5 fractions sometimes, or 1 to 5 fractions in lung cancer cases. And the cure rates are extremely good and complications are very low. Next slide, please. Next. These are some examples of how precise, because you can see the target, which is the cancer, in real time. The beam goes on only when the target falls into your dosimetric outlines. If it is outside, the beam turns off itself. So it is so precise. This is going to be another game changer in oncology. Next slide. And India, also the first machine will be coming up in Hyderabad very soon. The treatment of the pancreas, day 1, see the tumor, if you press on the, it will show the animation, yes, okay. You see the tumor in the pancreas on day 1, day 2, keep moving, day 2, yeah. See how the target is moving? If you use the same beam, standard beam, you will be treating only part of the tumor. It's adapting the beam to the shape of the target second day. Next one, continue. See, go to the third day, it went superiorly. So the target now is moving. So the beam also moves with the target. So this is adaptive radiation, which is another game changer in oncology. Next slide, please. The same thing in lung cancer also. You can go through the next slide or show the animation also on this slide. Especially in lung, the tumor in the lung moves with the lung. If you don't do adaptive radiation, you will be treating normal lung on day 2, day 3, day 4, not the target. Okay, press on the next one. It will show you how it moves. Next one. And next one. So is adaptive radiation, the target is always within your beam. Next one. There is an animation for the prostate treatment also. Push the prostate, you can see the bladder, the rectum behind, and the red line is the prostate. Red line shown is the prostate. Look at with each movement of the abdomen respiration, the target is moving up and down, sideways, superiorly, inferiorly. Unless you do adaptive radiation therapy, you will be missing half the target every day and tell the patient, we're sorry, we are not able to cure your cancer. The reason was half the time the beam is off. Our target is off the beam. You can show this in this animation. Okay, now come to the breast cancer. You can go to the next one. We made significant advances in breast cancer. Lumpectomy is the standard of care, and lumpectomy followed by radiation. For those non-oncologists, remove the lump in the breast and add radiation. The cure rates are identical as if you remove the entire breast. So more and more people all over the world, not only in US, India, and Europe, all over the world, the standard of care is lumpectomy, remove the lump, follow that with radiation. The radiation, next slide. The radiation used to be 5 to 6 weeks of radiation. People, living in big cities like New York, Manhattan, they cannot afford to come every day, Monday to Friday. So what my team has done innovative clinical research. Do we need 6 weeks? Can we go with only 3 weeks instead of 6 weeks? We did that clinical trial. The treatment outcomes are excellent. So then we moved to 3 weeks. 3 weeks to 1 week, the outcomes are identical with a different technique, different technology, and the cure rates are incredible. The complications are extremely minimal. So we moved to 1 week. Now, at the time of lumpectomy, we give single dose radiation. The single dose radiation is equivalent to 6 weeks of radiation. So the point here, take home point, when a standard of care treatment works, then we try to improve on how we can make it user-friendly, patient-friendly, to make the treatment duration shorter and shorter, that they can come, they have the lumpectomy and radiation on the same day, go home, and the cancer is cured. That is kind of clinical research I would like to encourage everyone in other institutions to continue doing it. Next one. In prostate cancer, we did the same thing. You don't need prostatectomy, or in selected cases only you need to remove the prostate. But other cases, the same way I have shown you with breast cancer, the treatments are condensed from 7 to 8 weeks to 3 weeks to 1 week to 1 day. Next one. These are some of the techniques I developed, which are used all over the world. Simplifying the treatment to 1 day. The patient comes in the morning. I get a lot of patients from India and Europe. We do the scanning and the procedure. He's aware, he's ready for a procedure in the afternoon. He goes home in the evening. Then we treated thousands of patients like this. All my students who are trained by me are practicing these techniques all over the country, all over the world. Next one. Next one, the outcomes are really, this gentleman, you all know. Next one. Next one, yeah. You all know the mayor of New York and one-time presidential candidate in the US. He's in the news everywhere. He has prostate cancer treated with single-time treatment, outpatient treatment. He is now 18 or 19 or even 20 years following the treatment. Next slide. There's so many techniques we developed. I will not go into details. These techniques have made significant impact on improving the cure rates. Otherwise, the patients would have lost their life. They will be gone in 6 months. And this particular one case, I will show you example. Then this patient, for those clinicians in the audience who know, the X-ray on the left shows a big mass in the right upper lobe. That mass, the right upper lobe, the other side. The white shadow on the right upper lobe. And this mass has invaded the spinal canal, vertebral body, and ribs. And this patient would have had only 6 months to live with this kind of presentation. And we resected the tumor, used some kind of innovative intraoperative technique, and gave radiation to the surgical bed intraoperatively. And this patient survived 10 years after treatment. And even though it's a single case report, I published that in JAMA, Journal of American Medical Association. Even though it's a single case report, this case was published in all the languages of JAMA, Japanese, Chinese, Spanish, everywhere, because this treatment was so innovative. Next slide. This is after removing the tumor. You can see the removed lung tissue with what is shown, the upper superior aspect is the tumor. And the margins are positive, so we use the intraoperative technique. Next slide. These are published, and all my fellows and people who work with me practice these techniques all over globally, everywhere. Next slide. One of the persons who this technique was more advantageous, and I used that, is our President Sanjeev Reddy. I had lung cancer, diagnosed in All India Institute, Medical Sciences. And they sent him to America, to our center, Sloan Kettering. And because he was a smoker, chronic smoker, he could not be resected. So we did the intraoperative technique on him. He survived about 18 or 19 years following the treatment. And this is one of the most gratifying examples of how a teamwork, working closely with all the oncological team, will benefit the patient, in this case, President of India. Next slide. So many other examples I can give. This child is a 20-year-old kid with a tumor in the elbow. You can see that nasty lesion you can see in the elbow. He has multiple treatments in the past. went to Harvard, Stanford, everywhere. And they all recommended to come to Sloan Kettering. And he came to us. This treatment, in this case, they all offered other places is take out the limb, cut the limb. That's the only treatment they offered. But here, being we are innovative institutions, Sloan Kettering and Cornell, we devised some new treatment where the tumor is resected and we placed intraoperative radiation just for the 2 days period he was in the hospital and put the graft on the resected side. And the slide with where he is holding the pen, he is 22 years following the treatment. And he is holding the pen. Why am I showing that is, he not only is cured of the cancer, his function in the hand is preserved. So these techniques, whatever we develop, should cure cancer, but also maintain the function in the limb. Next slide. This is another example, but if you can see, on the CAT scan side, you see a central mass, big mass. This patient came to me from Israel, has a hysterectomy for a cancer, and the cancer recurred within 6 months. And she went to UK and other places. They all said, we cannot cure you. It's only 6 months or 8 months to live because it is unresectable lesion. So she came to us. We designed a new technique, as I mentioned to you. We always take up challenging cases coming to us from everywhere. And we designed a new technique. We used the technique on her. You can see on the date on the other side is 1987. She continues to do well. This is nearly 25, 30, even more than 30 years. She continues to do well. The take-home message here is you have to understand the biology of cancer, how it is behaving in that particular individual, and develop treatment techniques based on that. In this patient, the biology is showing that it is going to be locally aggressive, not going anywhere. So we developed a locally aggressive treatment for her, and she survived 32, 33 years. And she sent me a New Year card every year. This year, last month, she sent me a New Year card saying, Dr. Nori, we just celebrated 60 years of our wedding anniversary. And the next sentence was very gratifying to me. 60 years of wedding anniversary, we celebrated, 30 years of which is given by you. So these are kind of inspiring stories that make you do more in oncology to help more patients nationally and globally. Next slide, please. So advances in oncology, to summarize, progress in cancer treatment will increasingly utilize individualized treatment strategies based on complex molecular biology of most cancers. One treatment doesn't fit all. It has to be individualized. Modern pathological characterization, the so-called NGS, will determine which tumors will respond to a particular therapeutic approach. That is already here. Targeted therapies with the drugs aim at EGFR receptors, tumor, environment, and angiogenesis are all here. Immunomodulation, either alone or in combination with radiation, will enhance the outcomes in majority of the cancers. I will submit one case in point. Stage 4 lung cancer patients used to have a 5-year survival of 4%. Now it is 25%, which is a significant improvement in the outcome of stage 4 lung cancer. Thank you very much. Thank you, Dr. Chinababu and all our members for inviting me to deliver this lecture.
Thank you, Dr. Nori. A big applause to you. And really, it is a very highly informative and inspiring, and to know how the advancements in cancer care is coming up, let it be immunotherapy or next-gen sequencing, molecular profiling studies, proton therapy, and all. This is really, a great improvement in cancer treatment. Unlike whenever we hear about cancer, it is like, oh, this is the end. This is the terminal illness. We die. But this is very informative. It gives an encouragement that life can be extended. Thank you for your wonderful touch. There is a healing in your hands that I can see from your presentation and from your work. Thank you. Thank you for extending the life of people. Not only extending, you're extending a healthy life of people. An example that you shared, 30 years of life you've given to a couple. That's really, really great. And as we see from the chat, that Mr. Ramesh Kazagaru, as you said, yeah, this information is required more for IT people, which includes me. That's really great. And thank you once again, Dr. Nori. It's really inspiration and informative message. Thank you again. Now I request Dr. Kiran Avancha to give the vote of thanks.
Well, I don't think, can you hear me?
Yeah, we can hear you, Kiran.
Perfect. Thank you very much. Hi, everyone. This is Kiran Avancha. First of all, I don't think we can top off Dr. Nori's presentation. I mean, it's amazing in terms, one, in all levels, having been a young cancer researcher at Memorial Sloan Kettering Cancer Center myself, I have had the privilege to look at Dr. Nori's work and had the privilege to work on several of these clinical trials that Dr. Nori had mentioned. So I think the advancements in this field are amazing as we have been progressing, not just now on the immunotherapies, but now there is more coming in the field of CAR-T and cellular-based therapies. So first of all, let me thank Dr. Nori. I think this has been such a wonderful and informative session, and I'm pretty positive based on the comments that we have seen that everyone is unanimously acknowledging the fact that this is the need of the hour. So first of all, thanks for joining us today for the second GGHS annual celebrations. I also would like to thank Dr. Varun Jeph, the DCG, for joining us and sharing the interesting fact that I wasn't even aware that this year is the International Year of Millets, but definitely we would take that into consideration and add that into our regular diet as such. Thank you, Dr. Varun. And I also want to thank our board at large, all our board members who had made such a wonderful effort in terms of keeping this together and having this presentation. And also all our regional directors. There are a wonderful team of regional directors across who have been selflessly doing this. I mean, we all have come into this with a selfless act, and to see that within 2 years, our organization has grown to such extent. And I also see that there is a tremendous support. I think I heard a presentation, a few minutes ago. I think there were about 160 at large members who participated on this call for this second anniversary of GGH. And I think we can't do our work without the amazing support of our donors. So I really, really would like to thank all the donors who possibly may not have been able to present on this call today. So I really think that it's the act of the donors that made our mission possible for what we are trying to do. So I think this helps us a lot. And I also want to thank all the volunteers. I mean, I think more than the donors, it's also the time and effort that the volunteers have put into this the growth of our organization, and for reaching the message to that the preventive health message, I think it's the new era of this personalized medicine that's going to be more and more. So we want to keep that at front and center of our thing. I think the next agenda is that there was a concept that our GGH wants to run, because we are a global organization. Want to ask that to run the national anthem of India for this year, and then moving forward every year we would like to choose the national anthems of the year countries in which we are participating for.
It's all right. Thank you, Kiran. Let's all praise for the national anthem.
भारत भाग्य विधाता
Jai Hind, and thank you all. Thank you, Dr. Kiran, for your thank you note. It was really a wonderful session. Padma, would you like to add something here before we close?
Yeah, we'll keep the PCR team.
Run for the cause, run for the needy, run for the freedom from cancer.
That's wonderful. Once again, thank you all.
Thank you everyone for joining the celebration of second anniversary of Global Grace Health. Thank you for all your support.